Hi everyone, this is Dr. Stefan. Welcome to interstitial lung disease.info. In this episode, I'd like to discuss about palliative care because many patients, many carers, many family members, people who suffer with pulmonary fibrosis think that when palliative care is recommended, this is the end. It's a terminal situation. And I'd like to maybe address some of these misconceptions and fear around palliative care and what is palliative care in the realm of pulmonary fibrosis. So I would say that, first of all, I would begin by saying that I'm not your doctor. I cannot advise what's this, in your specific case, what the best approach is. The healthcare team that's looking after the case is the best placed team to address all the questions in all the details in your particular situation. But overall, I would say that palliative care is care in order to live well. I don't know if that makes sense, but let me try to get a little bit deeper. So, for example, when someone develops pulmonary fibrosis and they're struggling to breathe, they have a lot of cough, they are finding it more and more difficult to do the regular activities that they were used to doing that gave them joy and pleasure. It's important to try to see what is the most you could do in that situation. And how can we simplify the treatments that someone is receiving? How can we offer supportive care, help at home, in the community, being involved in some kind of community to feel that you are part of a group? I think that's really important in order to gain an acceptance of this condition and an understanding of what can be done in your case. So I would say that's how I would summarize palliative care. This is my understanding of it. And also, we need to think about the fact that current treatments for pulmonary fibrosis involve maybe anti-scarring medication or anti-fibrotic medication, potentially anti-inflammatory medication, maybe oxygen therapy when needed, and pulmonary rehabilitation, which is basically exercise programs for the lungs. But besides these, we need to think about the situation more holistically, because many people who suffer with pulmonary fibrosis are actually slightly older, maybe in their 70s or 80s. They may have a lot of other conditions. They may have a lot of medications that they need to take, which may be interacting with each other and causing further problems. So this is where palliative care and a palliative care assessment can actually be very helpful to try to prioritize what is important for that particular person. And it's not always end of life care, because many people actually get discharged from the palliative care service after they've been seen and assessed and recommendations have been made. So it's really important to try to consider that the fact that palliative care is just a way to get a multidisciplinary approach in each case. So the palliative care team may involve palliative care doctors, physicians, nurses, psychologists, social workers. And this is important to get the support of the community. Accessing these services is not always easy, depending on where you are in the world, but I would say if they are available, I would not discount them, because you need to think about targeting different components of pulmonary fibrosis care. So we need to think about the physical. So palliative care may be able to support you with symptom management on how to deal with, for example, coughing, breathlessness, prescribing certain treatments in this regard, addressing potentially some exercises that you could do to help facilitate symptom management. Psychological support, so accepting the condition, strategies to cope, strategies to maintain dignity and control over the situation. And obviously, pulmonary fibrosis can be a terrible disease, especially as it's progressing and getting to the later stages. It can be really difficult. So having the appropriate psychological support is really important. And then there's also the social component, just having care at home and family support, and how can different people be involved in helping a patient with pulmonary fibrosis in the way that they want. Because sometimes patients have a very different perspective on how they want to be treated and how they want to receive the care. Some people want to maintain more independence. Sometimes they feel that the family can be a bit overbearing, or sometimes the family may be struggling to help and address the questions that patient may have or the support that they need. So it plays into a lot of these fields. There's also spiritual support, so I think that's really important, depending on your cultural beliefs and things like that. So just finding meaning of this bad situation, having potentially difficult terminal condition, chronic condition that makes you breathless. What's the meaning in that? And trying to again find acceptance through spiritual means, and maybe transitioning through these stages of the condition, through transitioning through life, making changes, making arrangements. There is also the component of end-of-life care, and I think this is really important to mention. It's very difficult to approach, to discuss, but it's really important to have the difficult conversations and discussions about arrangements for end-of-life according to each patient's priorities. And making plans is really important, just to have an idea of what may happen if things do go wrong, because then it could be a little bit easier. So, for example, making decisions in advance related to ceiling of care. So this is how much intervention will we be doing as physicians, when, for example, someone with pulmonary fibrosis develops a severe infection, a severe condition, they end up in hospital, and the chances of recovery are very, very small. Sometimes, as doctors, we can resuscitate aggressively. That can lead to a lot of other complications and a long road to recovery. And sometimes people really struggle to come back from a very significant event. And I find this very difficult to discuss because obviously, we all want to live as long as possible. We all want the best treatment that we can. But at some point, we need to try to consider accepting the fact that some of the interventions that we do, especially during resuscitations, can be traumatic, and many people do not, unfortunately, come back from that. So maybe having plans about having do not resuscitate orders in place are really important, just because we want to maintain dignity and comfort as much as possible. So palliative care also plays a role in helping loved ones. So relatives and friends of the person who has pulmonary fibrosis, because these people, maybe it's not really appreciated sometimes, but they do have their own suffering. They care about the person who has the condition. And sometimes it can be draining. So we need to think about how do we support them as well. So this is where the palliative care team may make certain recommendations involving other carers, giving people a little bit of a break, trying to do all these things. So in conclusion, I would say that palliative care is really hugely important in the field of pulmonary fibrosis, and not only, generally in the cases of chronic conditions that may be irreversible. It's an integrated approach to try to live well with this irreversible condition, to live as well as possible, to find meaning. It's not for everyone, but if it fits with your needs, I would say it's important to try to give it a go. I hope you found this helpful and reassuring and encouraging. And if you have further questions, please leave them in the comment section below. And as always, I apologize if these topics that I cover sometimes can be difficult to listen to. I'm trying not to offend anyone with these episodes, with these videos. I'm just trying to set the scene of what we do see in daily life and some of the struggles that do come up. Thank you very much for watching. All the best and good health.